It's Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. Last month, House Republicans passed a major budget bill that would make sweeping changes to tax revenue and spending in the federal government, including new work requirements and eligibility rules for Medicaid benefits and food assistance.
That legislation passed the House by one vote. Now it's being held up in the Senate, in part because of opposition from Republicans like Wisconsin's Ron Johnson, who are calling for more spending cuts.
In Wisconsin, almost 1.3 million children and adults are enrolled in Medicaid, and more than 700,000 receive food share.
What would those cuts mean here in the state? Bill Hanna is Medicaid Director at the Wisconsin Department of Health Services. Bill, thanks for joining us today.
Thanks for having me on.
Let's start by talking about who in Wisconsin is currently eligible for Medicaid coverage here in the state that looks like Badger Care and Badger Care Plus.
Yeah, as you mentioned, we have about 1.3 million people enrolled in Medicaid in Wisconsin. That's about 20% of Wisconsinites, covering kids, adults with disabilities, children with disabilities. And it goes by many names in Wisconsin, including Badger Care, Forward Health, Family Care, Iris, Katie Beckett, or CLTS. All of those programs are some form of Medicaid in Wisconsin.
As you look at the bill that passed the House in its current form, could be subject to change, we know. What are you looking at for the possible impact on coverage here in Wisconsin under Medicaid?
Yeah, the bill really focuses on the expansion population. In Wisconsin, that's about 194,000 adults. These are adults between the ages of 19 and 64 that do not have dependent children at home and have income below 100% of the federal poverty level. And to be clear, 100% of the federal poverty level is individuals making about $1,300 a month.
What would happen then under this bill? Would they be cut off, or is this focus on the work requirements? They'd have to establish that, hey, yes, I am working or actively looking for work to continue to receive Medicaid?
Correct. So the bill creates new work requirements for this population. We estimate that about 63,000 of the 194,000 currently enrolled are not meeting those requirements today. Certainly, we would work to encourage them and help them to meet those requirements. The requirements mean that these individuals need to meet 80 hours of qualifying activities per month. Qualifying activities include working, volunteering, or education in order to maintain their Medicaid enrollment. And that would be checked at the time that they enroll in Medicaid and at the time that they renew every 6 months, which is also a change in moving to 6-month renewals versus the current 12-month re-eligibility determinations.
People listening may say that doesn't sound so bad. This is not necessarily the original target audience for Medicaid. Do you see this causing potentially problems, people being kicked out of Medicaid who shouldn't be, or bureaucratic concerns with this?
Yeah, I think there's a lot of unintended consequences. I think only 2 states have really tried this in earnest several years back, Georgia and Arkansas. There was a lot of confusion in Georgia. They've been running this for 18 months and only 7,000 individuals have enrolled because they've got caught up in the paperwork challenges. So there's certainly the possibility that folks that should be eligible lose coverage because they can't make it through the paperwork hurdles. I also think when we look at who is working today, between the ages of 19 and 54, approximately 70% of those folks are working when you look at national data. It's when you get into that older range between 55 and 64 that number goes down. I think what you'll see is a bigger impact to that older population of primarily women. And what the bill doesn't take into account is, let's think of, for an example, a woman maybe in her 60s who was working and then stopped working to take care of her grandchildren because childcare is a challenge for folks to find. That individual would no longer be eligible for Medicaid. Creates all kinds of other challenges for families trying to make ends meet in Wisconsin. I think the other point is this will certainly increase the uninsured rate in Wisconsin. And what we know is that individuals, if they lose their Medicaid, doesn't mean they don't need health care. It means they just don't have a way to pay for it now, which will increase uncompensated care for hospitals, doctors, and other healthcare providers. And as we saw recently in Wisconsin, financial, income is important to hospitals, especially as we've seen closures in Western Wisconsin. Uh, and uncompensated care really impacts all of us. We're all healthcare consumers, and when hospitals don't have enough revenue to stay open, they have to pass those costs on to other healthcare consumers. So while this may appear to just be impacting those 63,000 individuals that we're talking about, this really has an impact across the whole healthcare economy in Wisconsin.
A couple days back, I talked to Wisconsin Senator Ron Johnson. He's worried about the deficit impact of this budget, but he's not worried about the cuts made to Medicaid in the bill. He says states have expanded Medicaid to cover those it's not meant for and kind of gamed the system. Here's a listen.
For every dollar the state spends on traditional Medicaid, the federal government kicks in $1.33. Again, it was supposed to be a shared responsibility administered by the states, so the states would control it, so they wouldn't offer it to ineligible individuals, wouldn't expand it where it becomes completely unaffordable. Obamacare, for every dollar the state spends, the federal government kicks in $9, which has led to all kinds of what I would call legalized fraud on the parts of state governments and those providers, provider fees, provider taxes. That's not health care.
And Senator Johnson told the Journal Sentinel this week he'd support eliminating a Medicaid provider tax that allows states to take in more federal Medicaid money. In effect, states like Wisconsin gaming the system. What do you think of that part of the criticism of how Medicaid is working now?
States are certainly not gaming the system. Everything that states are doing is currently allowable under federal law. And in Wisconsin, we're really in a different boat than much of the state. Or much of the country, excuse me. As you know, Wisconsin has done its own partial expansion, so we're not getting the 90-10 match like many states are for our expansion population. The state is putting up 40% of that cost. We are also in Wisconsin incredibly judicious with how we use provider taxes, always with a policy goal, with an end goal of making sure hospitals stay open and stay viable and continue to serve Medicaid individuals. And lastly, about unqualified individuals or ineligible folks, that's just not true. Wisconsin, all states go through a review by the federal government every 3 years, determining sort of our states making errors or allowing folks on the program that shouldn't be on the program. Wisconsin's most recent review was in 2022. We had a 99.5% accuracy rate. And when you talk about what's inaccurate, it's really about dotting I's and crossing T's, not that folks are ineligible. So the facts aren't there. We run a really good program in Wisconsin, and these cuts will hurt not only the individuals that we talked about, but again, our healthcare economy.
Bill Hanna is with us, Medicaid Director at the Wisconsin Department of Health Services, looking at the impact of the federal budget bill passed by the House, currently in the Senate. Moving on now, Bill, to SNAP, the Supplemental Nutrition Assistance Program called Food Share here in Wisconsin. Again, who can currently receive food share benefits in the state and who might not be able to under this bill?
Sure. So under food share today, there is already a work requirement similar to what we were just talking about. The current work requirement is for adults 19 to 54 without dependent children. What the bill does is it really expands who needs to meet the work requirements in order to receive food share benefits. It expands that age range up to 65. And now includes adults who have children over the age of 6. So we anticipate that an additional 88,000 people in Wisconsin will now need to submit additional paperwork to the state in order to prove that they are meeting those work requirements and in order to maintain their SNAP benefits.
What does this mean for the workload at the state with that additional documentation, both for SNAP and for those more people in those Medicaid work requirements?
Yeah, it's both additional workload. The bill also does other cost shifts from the federal government to states. Today, food share is matched 50-50 in terms of how we administer the program. The bill changes that to where the states now need to pay 75% of the cost to run the food share program. So it also includes right now the benefits, the cash that goes out, the Quest cards or SNAP benefits that go out to individuals are paid 100% by the federal government. The bill adds for the first time a matching requirement for states, at least 5%, which is $69 million per year in Wisconsin, and goes up to as high as 25% depending on a state's error rate. So the workload changes, the system changes we have to make in order to collect all the documentation, the cost shifting and administrative costs, and the new matching requirement for food share benefits. In the first year alone, we estimate it'll cost Wisconsin about $119 million just to maintain the program that we have today. That is in new state dollars to support a well-run program in Wisconsin.
A couple weeks back, we heard from Republican Representative Brian Stile from Wisconsin. Here's what he said about those SNAP cost shifts.
By having a fully federally funded program, a lot of states began to very poorly manage the SNAP program. This is all about strengthening the programs for those that it's truly designed for. And so a 5% cost shift from the federal government to the states, what that does is have states have some skin in the game. Wisconsin on the whole does a reasonably good job. Our error rate is reasonably low, although there's still room for improvement.
Bill, in our last minute, putting more of this cost in the state means the state needs to do a better job and be more efficient in managing. What do you think?
Well, I don't think the bill gave us any more tools to do that, and we already run a really good program. Our administrative costs are lower than the national average, and our error rates are in the top tier, and our timeliness rates are second in the nation. There's only one other state that can say that they do it for more cost effectively and get better outcomes than us. So I don't think that the bill really gave us any tools to do that. We have a really well-run program, as the representative said. This is really just a cost shift to the state.
Bill, we'll leave it there. Thanks again for joining us.
Thank you.
That's Bill Hanna, Medicaid Director of the Wisconsin Department of Health Services. We talked to him about how proposed changes to Medicaid and food assistance in the federal budget bill could affect people here in Wisconsin.
Coming up on Wisconsin Today, Adams County now has a sexual assault nurse examiner. Hear how a community health provider is able to offer a critical service closer to home.
Sexual assault is on the rise in rural Wisconsin. It's the facts of the matter. I think we see a lot of sexual assault and predatory behaviors that are happening as a result of social media.
That's ahead on WPR News.
It's Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. For the past 2.5 years, Adams County in central Wisconsin didn't have any hospitals or clinics that offered a sexual assault nurse examiner, known as a SANE program.
That meant survivors of sexual assault would have to drive upwards of an hour to Stevens Point or farther to Oshkosh or Madison to get the care they needed after a traumatic experience.
Earlier this year, the nonprofit community health provider Health First started a new SANE program at its clinic in Friendship, with the hopes of bringing this critical service closer to home for survivors in the area.
Adams County was one of several counties in the state that didn't have nearby clinics offering these exams. That's according to the state Justice Department's database.
Jesse Scharfenberg is CEO of Health First. Jesse, welcome to Wisconsin Today.
Thanks for having me.
Why is it important for you to establish a program providing care for sexual assault survivors in your Adams County clinic?
There is a huge geographical gap in services. It's something we've been looking at for many years since we started our SANE program in Marshfield, Wisconsin a few years ago. Where else are there gaps in services? And that is one of the crucial areas that we found to have a gap. And we work really closely with community partners in Adams County through the school district, local law enforcement, Health and Human Services, district attorney, and through so many conversations, it was just something that's needed and it made sense to do.
What happens when a community or a wide swath of an area doesn't have a registered nurse who has this special training to provide care for sexual assault victims?
There's really three things that could potentially happen. One, the individual just does not receive care. Two, they have to travel an hour or 2 hours to a health system that does provide the care. Or we often see delayed reporting because at that point in time, they don't want to travel, but maybe a week later, a month later, 2 months later, whatever that time frame may be, they may seek care outside of the normal time frame in which someone would receive care for a sexual assault examination. So when there isn't care, there are so many barriers for individuals who've survived an assault that we've been really looking at how do we break down those barriers so that we can get individuals into care quickly and they can have the medical screening processes done that need to be. And if they are wanting to report, getting that over to law enforcement in a timely manner.
Right. What happens when there is delayed reporting and it's not within a normal time frame? Can you give us a scenario?
Yes. So with the delayed reporting, one of the things that can happen is there's not the evidence to collect because it's been so long that the evidence could be washed away from taking a shower. It's just not on the body any longer. But more importantly, what we are seeing with delayed reporting is victim shaming.
Mm.
We hear a lot of, why didn't you come forward sooner? Why didn't you have an exam sooner? Why didn't this happen? Why didn't that happen? And it's really important that we have to acknowledge that survivors are on their own schedule and we need to support that schedule. And a way that we can support that schedule is having easy access to care. And there's no reason why an individual should be shamed or it should be looked poorly upon for them coming in a delayed manner because that's what their schedule is and what they're comfortable with. We have to acknowledge that the trauma that they have been through has to be processed in a way that makes sense for that person.
What about the travel piece, transportation, the cost of travel? Could those be barriers to skipping this exam altogether?
Oh, absolutely. If you're thinking you're in Adams, Wisconsin, and you have been assaulted and trying to figure out what the closest place for an exam is, oftentimes is Madison for those individuals or Wausau. So if we think about barriers that happen for individuals, maybe they don't have a vehicle. So how are they going to get there? Maybe they're out of work and they can't afford gas money. Maybe they have children and they don't have daycare that's going to be needed for an all-day appointment. So really being able to break down those barriers for immediate access in their community. And also just thinking, you live in a rural area, having to go to Madison can be really daunting, not just traveling and figuring that out, but you're in a really large health system and navigating that can be difficult for an individual. So being able to offer something local is extremely important for individuals. And it also makes it easier for our partnering entities, Hope House of South Central Wisconsin, have to give them a shout out. We love them, but they offer victim service and victim advocacy services. So they are present at examinations. So being able to do something local makes it easier for them to get to those exams to support individuals who have survived an assault as well.
What do you see the need is like, especially in Adams County? How big of an issue is sexual assault in rural Wisconsin communities?
Sexual assault is on the rise in rural Wisconsin. It's the facts of the matter. I think we see a lot of sexual assault and predatory behaviors that are happening as a result of social media and other things that make it easier for individuals to have access to others and start relationships and potentially end up assaulted. There is trafficking that happens in Wisconsin Dells, which is the northern part of Sauk County, but also the southern part of Adams County. So there's a lot of variables that go into play within that specific area. But just in Wisconsin in general, there's so many deserts for SANE services because geography is so spread out within rural Wisconsin. If we can bring local services for immediate access, it's extremely important. And it's been a gap that we've been able to fill.
Can you talk more about what comprehensive care looks like? What happens during one of these exams, or how do you preserve possible DNA evidence?
Yeah, absolutely. So an exam can vary greatly, but what we see is an exam on average can last 5 to 6 hours.
Mm.
So an individual is going to come in. We love having advocacy present. We'll call advocacy right away to make sure that they are there with the survivor. So that can take a little bit of time. There's a lot of talking that goes on during the examination of collecting the verbal evidence of like what happened, why are we here, having the survivor explain what's going on there. There's the picture taking that occurs to collect picture evidence, but then there's a full physical exam that happens as well to look at injuries, take pictures of injuries, collect evidence. So we have evidence collection kits that are from the state crime lab, in which we can collect that evidence and then law enforcement picks up and gets it to where it needs to go for processing. So there's the evidence collection, but we also do a lot of labs for the individual, and we'll do medications as well to prevent STIs. So we're going to look at HIV prevention for the individual. We're going to be looking at chlamydia, gonorrhea, all of those things that could potentially have been contracted during the assault. We're going to look at how do we give them prophylactic medication to prevent it.
Why does this require specialized training that a registered nurse normally couldn't do?
Because of the in-depth evidence collection that happens, and it takes a very special person who is extremely detail oriented to be able to go through the talking process, but the evidence collection process at the same time, being able to look at the human body and pick up on, oh, that's a scratch. We should take a picture of that scratch. We should also collect evidence. Maybe we need to be looking at under fingernails. It just takes a lot of time and effort and energy for a person to be able to do that. But there's also specialized training and around strangulation as well that happens with our SANE nurse examiners. So really that forensic side of things, not just a regular nurse can do, because it takes a lot of time, commitment, and effort and practice to really hone in on those skills of an individual who was assaulted comes in. What do we need to look for? And that's not something your regular emergency room nurse is trained in of. What should we be looking for forensically?
Jesse, what is your working relationship like with the state crime lab?
We have a great working relationship. They actually, a few months ago, were at our bi-monthly SANE meeting talking to our staff and giving more education. So it's been a really great to have those relationships and making sure that we are working really well with all of our partners, not just the crime lab. Local law enforcement is extremely important to have relationships with the district attorney's office, because SANE nurses can be subpoenaed to come in and testify during court cases. Having those relationships with advocacy centers are just, it takes a team. It's not just one individual, one entity. It's quite the process with many team members that partake in the process with a forensic examination or SANE examination.
We're talking about sexual assault nurse exams in rural central Wisconsin. It goes by the acronym SANE exams. We have Health First CEO Jesse Scharfenberg with us. Jesse, what is the investment like for Health First to have this clinical offering? Is it as simple as just staffing a specially trained nurse at a location?
Yes and no. There's some complexities that go along with it because we need more than one SANE nurse. Because of call schedules, an individual can't be on call 24/7. So it's figuring out the staffing. There are some special equipment needs that are needed around a camera, an alternative light source, and also just making sure that the room is set up to acknowledge the trauma that an individual has been through. So lighting is a big factor, coloring is a big factor. So it's taken a little bit of work to kind of figure out exactly how we want our examination rooms to look. What are we going to have there for resources? But I would say that's a very, very minimal investment compared to the investment we are making in individuals and survivors of sexual assault and giving them the opportunity to have their voice that has often been taken away from them. Also, state of Wisconsin has what's called the SAFE Fund. So from the fiscal standpoint, they actually reimburse the time for a provider to provide the SANE examination. So it covers you don't make money off of it, and we would never want to make money off of it, but it covers the cost. So it's a pretty dollar in, dollar out model. But it's just amazing to be able to offer it in the communities that we do.
What does the workforce look like for this type of specialty care? Is it a challenge to staff nurses who have this specialized training in sexual assault care across 10 clinics?
Yeah, it is very difficult for staffing. It takes a very special nurse who wants to have the additional training. But then we talk a lot about vicarious trauma and the trauma that individuals who are SANE nurses are exposed to results in a lot of burnout. So we've worked very hard to set up ways and means of communication if they're getting to that point, and having debriefings and just being there to support our staff. Because we know the burnout is so high, we do have to expect some turnover, but we've had a pretty consistent staff since we opened our location in Marshfield. But we're always open to recruiting more individuals, especially in the Adams area as well, to continue to support that so that one individual is not doing everything.
Other healthcare providers had previously provided sexual assault exams in Adams County, but ended them for financial reasons. Will this be more sustainable for you at Health First?
We have found a sustainable model that we started in Marshfield 2 years ago, and I feel that we can easily replicate that in other locations, and that's our goal. I mean, Adams is just one stopping point. We have many other locations that we're looking at replicating in the coming years to ensure that there's equitable access across our service area in Wisconsin.
Have you been receiving referrals? And if so, from where? What is that like?
Yes, absolutely. So we have a multiple referral sources. So it might be law enforcement that's calling to notify us. We see it a lot through advocacies like Hope House or the Family Center up in Wood County area. And then also just self referrals. So we have a phone number that individuals can call, and they might just self refer that they need a SANE examination. So we will have whoever's on call go in and take care of that. We always work with advocacy, though, very closely. So if someone is going to self refer, we're also going to call advocacy if that is something the individual wants. To be there and present to support an individual through an examination. Not all SANE exams are reported to law enforcement. That is ultimately up to the individual if they want to report or not. So we kind of work that case by case based on what an individual's needs and wants are.
What if the individual doesn't have health insurance when they come in for the exam?
That is no problem. We don't bill health insurance for the examinations anyways. So if an individual needs services, we are going to see them regardless of a payer source.
And how do you prioritize what kinds of reproductive health and mental health care to provide at your locations? What do you look at in order to figure out which services are important and viable where?
That's a great question. As we've just recently expanded into mental health about a year ago, it's all based on community feedback and community needs. So, for example, with our mental health clinic, that came from our practitioners seeing individuals within reproductive health who needed referrals to mental health, and there were 6-month wait lists.
Wow.
So it's like, wow, that is a huge wait list for individuals who have immediate needs. So does this make sense with our mission to take this on and expand that service? And it was. With our SANE services, we actually had recruited a nurse practitioner who was a SANE nurse and said, hey, there's no longer services in Marshfield. Does this make sense for us to do? And when we look back at our mission and who we are, yeah, it makes sense for us to do. So really looking at what the needs are, what the community wants are, and then also talking a lot with our community partners of gaining their thoughts and insight of, does this make sense? Is this duplicative of other services, or is it an actual gap?
Jessie, is there more you'd like to see the state or the federal government do to support sexual assault exam programs like yours in rural areas?
I would love if we had at least one SANE program per county. It would be amazing. It would increase access. It would increase reporting. It would increase prosecution. Uh, but there's just so many barriers for not having that. So there is financial costs. There's a bit of overhead for things to get going in a program, and then also making sure that you are preventing burnout and prepared for burnout and or turnover. So some grant funding that is there to help with implementation and those startup costs would be great, because once you're up and going, I feel that the programs can be pretty self-sufficient.
How can a program like this affect or increase the quality of life in a community?
Oh, hugely. If we have survivors receiving immediate access, we think of all of the healthcare concerns that can happen after a sexual assault. So, getting immediate access to healthcare is extremely important. But then also, as we look at the other social determinants of health, if we can get an individual access to care through healthcare, and then we have the examination, maybe we get them access to mental health care. Maybe we can help get them the financial resources that they need to maybe break away from their abuser. There's just so many areas in which health equity and social determinants of health can be impacted by just offering a SANE exam. I think I could probably talk all day on that.
Jessie, thank you so much for joining us.
Absolutely. I appreciate your guys' time and the invite to be part of the show.
Jessie Scharfenberg is CEO of Health First. That's a nonprofit community health provider in central Wisconsin. She was with us to discuss the importance of sexual assault exam services and the challenges that come with providing it in rural areas.
Still ahead on Wisconsin Today, efforts to protect the elusive prairie chicken in Wisconsin's grasslands go way back to the land ethic of Aldo Leopold.
They're just an amazing bird and a great symbol for grasslands, which are very important habitat that we have here in Wisconsin.
Meet the DNR's prairie chicken specialist next on WPR News.
This is Wisconsin Today. I'm Kate Archer-Kent.
And I'm Rob Farrett. It's time for Wisconsin Life. Here's producer Bridget Bowden with a story about an independent bookstore that's become a destination for readers. It's part of WPR's Wisconsin Road Trip series, which kicks off today.
Even in our era of two-day shipping and instant downloads, many booksellers are finding that readers still want the connection of finding their next read in store. WPR's Hope Kerwin hit the road for our Wisconsin Road Trip series to visit a unique bookstore in the Driftless area of southwestern Wisconsin that's bringing in more customers every year.
It's another room that's mainly on the outer walls, all fiction. And then
Eddie Nix opened Driftless Books and Music in Viroqua more than 20 years ago. The used bookstore is located in a century-old warehouse, left over from the days when local farmers grew tobacco for extra cash. The brick building still has Viroqua Leaf Tobacco Company painted across the front in fading black and white letters. But today, the two-story warehouse is packed with used books, organized in a maze of bookshelves and stacked onto every surface.
I mean, there's always more coming in than are going out on any given day, which, is kind of maddening. But somehow the universe just makes a little more space every day.
Shelves stretch from the creaky wooden floors to the exposed rafters. It's the kind of place where you can easily lose track of the hours spent browsing and will likely walk away with a book or two you didn't know you were looking for. Nix's store has become a destination for book lovers from Wisconsin and across the Midwest. During the busy summer months, he says it's not unusual to have 10 customers waiting to check out, some from as far away as Chicago or Minneapolis.
I can kind of hear them when they come in, and a lot of times it'll be like, oh, that smell. It smells so good. You know, there's something about decomposing paper that gives just some homey smell feel.
2024 was the first time in-store sales exceeded the profits Nix gets from selling rare books online. And he's not the only independent seller seeing more customers walk through their doors. Grace Hagan from the Midwest Independent Booksellers Association says increased demand has supported new stores opening around the association's 9-state region. Hagan says interest in buying from indie bookstores picked up during the COVID-19 pandemic, and it's continued thanks to the growing community of readers on social media platforms like TikTok and Instagram.
I don't know where bookstores would be if that technology didn't exist, because that is a group of people that are huge consumers.
She says booksellers have also seen more sales in response to the rise in book bans at libraries. Many stores have made it a point to advertise the availability of banned books, from stories of Black and LGBTQ people to topics like abortion.
I think it is a place that people feel more comfortable accessing that information.
She says bookstores have become important places for readers to connect, from community events to weekly book clubs. It's something Nix has prioritized for years at Driftless Books and Music, where he's hosted hundreds of book readings, concerts, and even potluck dinners. And across the state in Milwaukee, Satonia Weston says events are a critical way to attract customers to her newly opened store, Niche Book Bar.
You know, maybe they're there for the poetry event and maybe they're not huge readers, but okay, maybe something catches their eye.
Weston has been working to open her bookstore since 2018. She sold books from a bicycle-pulled cart during the pandemic before finally opening her brick-and-mortar location earlier this year. Niche Book Bar offers a wide variety of books from Black authors and has an in-store cafe serving coffee and wine. Weston says she loves the daily rhythms of opening the store.
Flipping the sign, updating the chalkboard, putting it out, just those sort of things.
And she loves helping customers connect with a book that she enjoyed as a reader. She's found that as much as her customers are there to find their next to be read, they're also looking to connect with her as a fellow book lover.
WPR's Hope Kerwin brought us that story on Driftless Books and Music. Wisconsin Life is a co-production of Wisconsin Public Radio and PBS Wisconsin. Additional support comes from Lowell and Mary Peterson of Appleton. I'm Bridget Bowden.
Join us every Friday this summer for more Wisconsin road trips as WPR reporters make pit stops around the state to explore some of the people, places, and things that make summers in the state special. To see all the stops and plan your own road trip, find the series page at wpr.org/road trip.
This is Wisconsin Today.
In the central part of the state, an elusive bird called the greater prairie chicken lives in the grasslands of Portage County. Its conservation efforts have a long history that's connected to Aldo Leopold and preserving Wisconsin's prairie ecosystem.
But over the past 70 years, the prairie chicken population has seen significant decline, and it's a threatened species. The Buena Vista grasslands in Portage County is one of the last remaining habitats for prairie chickens in Wisconsin.
The Department of Natural Resources recently held its Greater Prairie Chicken Advisory Committee meeting to review the progress toward a long-term management plan.
Senior wildlife biologist Lisa Kardash leads the committee and is the DNR's statewide program manager for prairie chicken conservation. And she joins us now. Lisa, welcome to Wisconsin Today.
Thank you.
Prairie chickens are similar to domesticated chickens, but they're rarely seen. They're also found only in specific areas of our state. And you've become an expert on this bird. Why are they significant to Wisconsin?
Oh, prairie chickens are a native grouse species in Wisconsin, and they've been around for a very long time. You know, since before settlement in the state, back in the 1800s, we had prairie chickens in the southern half of Wisconsin. They originally were found in the prairie and oak openings of the southern half of the state. And they're just an amazing bird and a great symbol for grasslands, which are very important habitat that we have here in Wisconsin. Prairie chickens require very large blocks of open, relatively treeless grassland habitat. When we manage for chickens and when we have chickens present in Wisconsin, that means we are supporting an abundance of so many other grassland species that are out there.
It's clear that you care deeply about their wellness, about their longevity here in Wisconsin. You know, why should we care about their future so much?
Caring about their future is definitely important because they've been struggling for quite some time now because grasslands are highly threatened. This is something that we see in a trend, not just in Wisconsin, but across the nation. It is one of the most threatened landscapes that we have. And so species such as prairie chickens that exist in these grasslands, they're dependent upon them. And so to have them be here in Wisconsin and to have those grassland habitats are just essential and very important. It's a really good indicator for us on how we're doing with managing our grasslands and ensuring that we have this habitat here in Wisconsin.
Can you describe what they look like for us?
Absolutely. So they're about the size of a domestic chicken. I kind of, relate them to being somewhat of like a standard football in size. And they have alternating brown and white plumage that appears striped. They have a short, rounded tail, and they really do blend into the grassland landscape that they live in. And a lot of times people don't even know that they're there because they do a good job of blending in with the grass. The males, though, when you do see them, especially in the spring on their breeding grounds, which we call the booming grounds, are very distinctive. So the males have these orange eye combs above their eyes. They have these big orange air sacs on the sides of their neck, which they blow up when they're booming on the breeding grounds. And these really long feathers called pinnae that they lift up over their heads as well.
So this booming time, I understand this is like a ceremony that pits birds against each other as male chickens kind of claim their territory. What is this behavior like?
Oh, it's an amazing experience if you get to see it. So in the spring, typically, in late February into March, the males will end up coming onto the booming grounds, which are their breeding grounds. And these are areas that are very flat normally, very open, so they can see around them, and very low vegetation typically. The males will come out in the early spring, and they do a lot of defending of their little territories that they have on these booming grounds to ensure that they have what might be considered the best spot on the lek, which is also a booming ground. Later on, the females do end up coming early to mid-April, and that becomes the peak of the breeding season. But on these grounds, it's just amazing to see what they do. The males have an elaborate display so that they can attract the females to them to hopefully have one of the females select them for mating. The males will inflate those orange-yellow air sacs that are on the sides of their neck, and they force the air through them to produce this beautiful, deep, 3-syllable call. The air sacs, they basically act as resonating chambers, and they amplify this call that you hear. And when they're doing that, they raise their pinnae, those long neck feathers, they raise their tails, they put their head down, and then while they're booming, they'll stomp their feet rapidly on the ground. And sometimes they'll turn around in a little bit of a circle that's been described as looking like a mechanical toy.
Take us to the 12,700-acre Buena Vista Wildlife Area. What is it like to stand out there?
Oh, gosh. It's an amazing area. There really aren't too many places in Wisconsin that you can go now to have an open vista. I mean, basically, Buena Vista means beautiful view, and it is absolutely true. You stand out there and you just have an amazing expanse of open grassland. The sunsets and sunrises are just amazing. It's home to so many abundant species that we don't have in many places. So our neotropical migrant bird species that come in each spring are here, and right now it's just a great time to visit the Buena Vista grasslands. We've got so many species, savanna sparrows, grasshopper sparrows, upland sandpipers. I mean, you name it, we've got it out here, as well as a lot of very rare invertebrate species like the regal fritillary butterfly, which is a state endangered butterfly, and the federally endangered cardinal blue butterfly as well. So it's just a beautiful property that you can walk around on in the grass. We really don't have hiking trails, so you can go wherever you wish and enjoy the birds, enjoy the quiet, just really enjoy that open view that you do not really get anywhere else.
We're talking with DNR wildlife biologist and prairie chicken specialist Lisa Kardash. She's leading the DNR's management plan for this species. Lisa, let's talk about the management plan. It's considered in our state of threatened species. The DNR created a 10-year plan to help manage prairie chickens, and you recently held an advisory council meeting to review the progress. How is it going?
Well, we feel we're doing pretty well from where we started back when the plan was approved back in 2022. We set a lot of really big goals for management, both on public lands and private lands. For public land management, some of our goals were to really increase the amount of brush removal that we're doing on our public lands. So that is trees and brush that we are trying to remove to create that open vista that prairie chickens prefer and other grassland species. And prescribed burning, we've been able to implement pretty well on the properties as well. We've got conservation grazing, and that's grazing that we do with private landowners on our public lands and private lands as well. It's a form of grazing that we can manage to allow for habitat providing for grassland species while also providing forage for the livestock, which is a really great tool that we've had. In addition to that, we do a lot of control of invasive species that we have on the property, plant species, particularly like spotted knapweed or Canada goldenrod and wild parsnip. And in addition to that, we also hold some farming leases on the properties where we can do some farming that helps us with the property to maintain it in an open grassland condition, but it's also bird friendly. For example, we have late season hay harvest or some rotational row cropping where needed.
What impact is climate change having on your work to preserve and protect the prairie chickens?
Sure. Well, climate change is definitely a threat to a lot of our grassland species. It's a big concern for us and certainly for greater prairie chickens. We have projected increases in spring precipitation and the frequency and magnitude of severe weather events, such as increases in summer temperatures. Prairie chickens are very sensitive to weather extremes. So things like heavy rain or cold, wet springs or heat stress can end up reducing prairie chicken survival. So that is something that we're definitely concerned about. And in climate change, with loss of grassland, which is another concern for us, it's a threat for prairie chickens because if they don't have that grassland habitat to provide them those protections to keep them safe from changes in climate change, it makes them more vulnerable. Prairie chickens also have very limited dispersal. And so they're less likely than many other species are to leave in response to unfavorable climate change within the areas that they currently reside.
Meanwhile, Lisa, Wisconsin's prairie chicken management program, it is nationally recognized as a successful model for habitat management. What stands out to you about it? What is exemplary?
For me, it's how long it's been going on and how many dedicated professionals and organizations have committed to prairie chicken conservation to ensure that they've been here for so many decades.
Thank you so much for sharing this history of Wisconsin conservation. Thank you for joining us, Lisa.
Yes, absolutely.
That is Lisa Kardash, a senior wildlife biologist at the Wisconsin DNR. She is a specialist in prairie chicken conservation. And the sounds we heard of prairie chickens during our conversation, those are from the Cornell Lab of Ornithology.
We just got a video update from Kyle Parker of Hayward, who's in the process of paddling and portaging about 5,000 miles.
Wow. Kyle is canoeing from Washington to the southern tip of Florida. Let's take a listen.
Good morning, Wisconsin. Kyle Parker here coming at you live from Idaho. That's right. I'm over 35 days in to my cross-country canoe expedition, and it's been a wild ride so far, but the toughest part is yet to come.
The toughest part, he says, 150-mile portage over the Continental Divide.
Thank you so much for checking in, Kyle. And P, well, if you are on a journey, send us a dispatch along the way.
Even if it's just a half-hour hike, tell us about it. Keep in touch. Email wisconsintoday@wpr.org. You can call or text us at 888-642-0232.
Wisconsin Today producers include Beatrice Lawrence, Lauren Cox, and Mackenzie Crummy.
Our technical directors are Sarah Hopeful and Tyler Ditter.
Managing producer is Tim Peterson, and Dean Knetter is executive producer.
Learn more about us at wpr.org/Wisconsin Today. I'm Rob Farrett.
And I'm Kate Archer-Kent. You're listening to WPR News.